everybody. It's Dr. Hammerstedt. So I was having a little rotation of the phone problem. It's really weird that Facebook Live will only let you do this when you are like in landscape mode. Anyway, I have this really exciting person coming on today, Dr. Rachna Patel, and she is joining me here in just a moment. I'm going to bring her on camera. Talk to us today about medical marijuana. She is an expert. Did you know that 30 states, including now Oklahoma, have medical marijuana that is legal? My brother lives in Oklahoma. I can't believe that Idaho, where I live, doesn't have it, and they do. There's 9 recreational states. Vermont was the first one this fall to actually get recreational marijuana through on legislature, not on the ballot initiative. So that's super exciting. 64% of Americans approve of legalization. And now we're talking about CBD, and we're talking about, all of the attention that people are getting to this. We're talking about doctors who are starting to be involved in how this can help with health and wellness. It is a big topic, but as with everything, I always want to make sure that all of our patients and clients and our families and our communities are really getting the information from the experts. And as with most health and wellness, I'm biased. I think that physicians are the most highly trained to be able to provide this information for us. And I'm still trying to get her on here. Sorry, everybody. Let's see here. Rachna, I'm going to try to put you on again. There we go. Adding. And I just worry a little bit about everyone not having all of the best information.
There we go.
Hey there. How are you?
Hi. Good. How are you?
I'm good. Are you in landscape mode, or are you upside down?
I can change it. How's
Perfect.
that?
Good.
Okay,
It's
perfect.
Good. Hey, Nancy, real quick, can you put in the comments whether you can see both of us in sideways, or if we're looking all funny? Thank you. It may be that we have to start over, because if you're up and down, sometimes it doesn't work very well. But welcome.
Okay.
I'm so excited that you're here. We were just talking a
Yeah.
little bit about health and wellness, and how I'm just really hopeful that we can get the best information out there for our clients and communities and patients,
Yep.
from the physician perspective. There's a lot of misinformation, a lot of great information, and who is doing what is really important. So I wanted to have you introduce yourself. I just want to tell you that I wanted to tell everybody that you are sort of in the middle of a big change, and I'm really excited for you about that. You've been in California. You've been working for a long time in a brick and mortar clinic doing medical marijuana. You're a great expert in this, and now you're moving in. So tell us a little bit about your background and your story.
Yeah. So my background is actually in emergency medicine, just like yourself. And I ventured into medical marijuana one sleepless night. I was wired during residency. I just didn't sleep. And so I would surf the internet when I got really, really wired. And I was surfing Craigslist. And that's when I came upon an ad that said medical marijuana doctor needed. Now, one of the things that was sort of really bothering me when I was undergoing training was that, on the one hand, I was handing out prescriptions for pain medications mainly. And a lot of times these patients would come back saying that, the medication didn't work, or they'd complain of side effects of these medications. And the worst case scenario, I'd be resuscitating someone who overdosed on these prescription pain medications. So I really felt like, okay, I'm not solving a problem here. And in fact, I felt like I'm creating a problem. So that night when I came across that ad, I started to look into it. And I spent a year looking into the research. And by about the end of the year, I was convinced that, okay, you know what? Medical marijuana has a lot of potential to treat chronic pain. And what I want to do now is gain clinical experience, right? Because the books can say one thing, but then real life, it can be something completely different. So that's in 2012 is when I signed up to work at a medical marijuana clinic out in California. And I've been in the field since then. And at this point,
Awesome.
I'd say there is no turning back.
And really on the forefront then, right? I mean,
Yeah, there's not too many doctors doing what I'm doing.
Yeah.
So yeah, I guess, I would say, yeah, on the forefront.
Yeah. So tell us a little bit about, how, pharmacologically, medical marijuana, like how does it work on our brain? And then we'll talk maybe a little bit about kind of what the best evidence is for what you think it's best used for.
Sure. So main thing is that you have what's called the endocannabinoid system, right? Just like many different biochemical systems that we have in our body, we have the endocannabinoid system, not very well studied, which is why many physicians aren't familiar with it, and they haven't learned about it in medical school. But you have the endocannabinoid system, and you have receptors, cannabinoid receptors. There's mainly two types that we know of at this point, and then three sort of, I would say, secondary ones. And they interact with endogenous cannabinoids, right? So these are chemicals that we make in our own bodies that are basically the twins of the chemicals made by the marijuana plant. And that's why we react to these chemicals in the marijuana plant. The chemicals in the plant are very similar in structure to the chemicals that we make. So I don't know if you're familiar with these chemicals, but there's anandamide, which is very similar in structure to THC, made by the marijuana plant. And then you also have 2-AG, another chemical a little bit similar to THC. And that's essentially what's going on, is that you have these chemicals reacting with these receptors, creating a series of reactions. And that then has impact on things like pain, mood, sleep, all sorts of different things.
So sort of like and I'll like simplify it a lot, but sort of like any medicine that we take unlocks a cascade of
Yep.
hormones and like I think of like hormones as like the lock into a key, a key into a lock,
Yep.
right? And
Mm-hmm.
unlocking that.
Yeah.
And so using marijuana as a medicine kind of moves on the various cascades. And so what is the end pathway of those cascades that work the best for people? Maybe give us the top 5 things that you think medical marijuana really, really helps with.
Okay, so the top three conditions that I've treated at my clinic in California are chronic pain, anxiety, and insomnia. Now, what's interesting is that being a physician in California, as a medical marijuana doctor, I had a lot of freedom. Most other states, they have a sort of restricted set of medical conditions that doctors can treat with medical marijuana. I had no such restriction in California because in California there's always loopholes, right?
Yeah.
And so somebody snuck in the phrase, they did have a list of conditions, but then someone snuck in the phrase, and any other illness. So really it was up to me as a physician to assess the patient's situation and then determine, okay, will this patient benefit from medical marijuana or not?
We got to thank whoever that was for some physician autonomy right
Yeah,
there. Yeah.
right, exactly. And so because of that, I got to see number one, I had the privilege of treating all sorts of rare conditions, but then also the common conditions like chronic pain, anxiety, and insomnia. Now, typically, anxiety and insomnia are not on the list of conditions. They may be added on later on, but initially, the states don't have that, down for whatever reason. So, but I would say those are the top three conditions. Now, chronic pain is fairly broad, right? But I would say mainly conditions that are resistant to conventional treatment. So, migraines, fibromyalgia, arthritic pain, and conditions where the side effects of the medications, of conventional medications, can have long-term consequences on the patient's body, right? So even something as simple as taking Tylenol long-term for arthritis, that can have impact
Right.
on the liver, right? Liver
Right.
functioning. And so, so those are the main conditions. Back pain due to sciatica.
Yeah. Because we
Those are
know
the common
opiates and
conditions.
muscle relaxants don't work for back pain. So yeah.
Right, right. Yeah. And the thing is, I think, you know what? Opiates have their place, but I'd say you're better off using opiates for acute pain, not chronic pain, because they're
Right.
so highly addictive.
Right.
So,
Absolutely.
yeah.
So what are the so we're talking about side effects from medications that we would use. What are like the biggest concerns with people using medical marijuana in terms of
Hmm.
side effects?
Yeah. So I want to sort of put it into perspective. Just like any other medication, side effects occur when you typically take too much, right? and when you take toxic levels. So there are potential for side effects, and it depends on which chemical you've taken too much of. So I'm going to backtrack a little bit here. Everybody knows about THC that's made by the marijuana plant, but another chemical that's made in high concentrations is CBD, cannabidiol. Okay. So let's take it chemical by chemical. So excess amounts of THC is what causes that psychoactive effect, right? So we're talking about things like anxiety, paranoia. If you really overdo it, that's when you start to get hallucinations, maybe even some nausea and vomiting. CBD, typically, if you overdo that, it can make you groggy or tired. So those, I would say, are the main side effects that are caused
and
by
in
those
states
chemicals.
that are that have recreational marijuana,
Yeah.
there are kind of lots and lots of processes to separate the CBD and the THC into two different products, right? So you
Well,
can,
yeah. So what
yeah,
happens there is that you have plants that make differing amounts of CBD and THC just naturally because of genetics and because of the environment in which the plants are grown, right?
as
And
with
if
anything,
it
yeah,
right, and just to get sort of scientific about it, it really comes down to this two enzymes. You have CBD synthetase, and then you have THC synthetase. And depending on the amounts of those enzymes, you may have, with more THC synthetase, you have more THC. With more CBD synthetase, you have more CBD. And so what becomes important in these situations is to make sure whatever product you purchase is laboratory tested, because that will then give you the amounts of the CBD and the THC.
Yeah, awesome. So we have Dr. Nancy Rolnick watching. She's from Walnut Creek area as well. She's a sports medicine doc. She has a question on here saying, for joints, do you think cream is more or less effective than other sources for pain control?
It's going to depend on the joints, right? So it depends how deeply the topical can penetrate. So, with areas like the hands and the knees, topicals do work well, but depends also on the severity of the pain as well. In areas like, I would say, the hip, doesn't work well because it doesn't penetrate as well in those areas.
That makes sense. That's really interesting. So give me two really great patient stories.
Two really great patient stories. Okay, so one of my patients had arthritis pain, right? Elderly woman, probably in her 60s to 70s. And one of the things that bugged her the most was that she couldn't pick up her grandchildren because of the arthritic pain. And I think that's huge, in terms, it seems like such a minor thing to have hand pain, but when that hand pain doesn't allow you to pick up your grandchildren, it affects the quality of your relationships.
Absolutely.
And so, she came to me, we treated her, and then a year later, she says, Dr. Patel, I can now pick up my grandchildren. I can hold them, I can, in a way that I haven't been able to before. So that's pretty profound. The other thing was that I had treated a patient with a history of sexual trauma, rape, essentially, right? And so she told me that, so she had a lot of, anxiety associated with intercourse. And she had been on conventional treatments for anxiety, so benzos, SSRIs, and nothing was really, working well enough for her. And so she came to me, we treated her anxiety with the medical marijuana, and, it helped her during intercourse where she wasn't feeling anxious anymore. So it helps in many, many different ways, and it impacts lives in a way that I myself had never imagined.
So I'm imagining that you have clients come to you either virtually, although you've had a clinic for a long time, and I'll ask you more about that in a couple of minutes so people know how to find you. But do you do an assessment like we do as physicians, and you sort of determine, the percentages and the amounts of what they need with their condition?
And I
really interesting.
Pretty much have it down to science where I have protocols by medical condition, right? So if you come in with, and there's always, like, obviously deviations from the norm. But if you come in with arthritic pain, I can tell you, okay, in this situation, topicals will work. In this situation, topicals won't work.
Yeah.
If you have back pain from sciatica, I can walk you through
And
how
let's try
much,
this dose, and if it's too much or too little,
yeah,
and yeah, like
yeah,
any
but
medicine.
yeah, and I would say the trial and error is after having treated so many patients, you kind of, you can get it down to an exact amount and type of marijuana to use. So there's less trial and error.
Yeah.
And the difference is that, now people don't have to rely on somebody behind the counter at the dispensary who
Right.
may not necessarily be medically trained, and
Or some guy on the
oftentimes,
street.
right, who's
Right.
speaking from like their own personal
Right.
experience
Right.
with using medical marijuana.
Yeah.
Yeah. So that's what I'm doing. And so specifically what I'm walking them through is which strain of medical marijuana to use. And, sometimes even CBD oil works. So
Yeah,
we
I was
talk
going to
about
ask
that.
about the oils for
Yeah.
people who, either don't want the effect on their lungs, or people I can imagine too who just have a stigma of like not wanting to be like smoking pot. I feel like
Yeah.
oils are a lot more attainable for the general population.
Yeah, so it depends, right? Depends if CBD is going to be effective for that particular medical condition. If it is, then yes, that's a good option. The important thing to realize, though, is that most of what's available is hemp-based, not marijuana-based, right? So basic difference between hemp and marijuana is the amount of THC. And this is a legal difference. It's still the same species and genus of plant.
Yeah.
And so basically, hemp by law has less than 0.3% THC.
Okay.
And by default, marijuana has more than 0.3% THC. So it's going to depend on the medical condition if, the CBD is going to be more effective for you than THC.
And that's going to be dependent on your state then, right? Because you can get CBD in other places, can't you?
Yeah, so what I would say, if I had to make a general statement, that hemp-based CBD oils are a lot more accessible. There's a handful of states that have deemed even CBD illegal.
I think that's my state.
What state are you in?
I'm in Idaho.
I think that might be one of the states.
Yes,
Yeah,
yes.
so
We're
just a
generally a little
few.
behind the times.
Yeah, so they've deemed CBD illegal. But I would say most other states, there are exceptions, most other states are okay with using hemp-based CBD.
Yeah, interesting. So, and I keep saying I want to get back to what you're doing. I'm leading everyone up to this exciting finish. But what other legal barriers are there for, like, in a state like California where everything's legal, or in a place where it's just medical marijuana? I'm sure that it's very state dependent, but give us like just some general overview of what patients need to worry about and what physicians need to worry about.
Yeah, sure. So let's go do this in general categories of states. So you have states where marijuana is legal for recreational use, right? So basically it's like a liquor store. You just walk in, as long as you're over the age of 21, you can purchase marijuana. And in these states, hemp-based products are usually covered under the legal protections for marijuana as well. Then you have states where marijuana is only legal for medical use, okay? And in this case, you do have to see typically a physician. Some states allow like naturopathic doctors as well to issue what are called medical marijuana cards or certifications.
Yeah.
And again, in these states, hemp-based products are protected under the legal protections for marijuana. So typically you don't need a card or certification for hemp-based products, okay? Now, then the third category of states are states where marijuana is just straight out illegal. Mm-hmm. But within these states, you have the states that still they have what are called CBD only laws.
Yeah.
So they're still okay with products that sometimes they specify a specific amount of CBD and they specify a specific amount of THC. I would say the vast majority of these states are okay with hemp-based CBD products. Yeah. And then, like I said, there's a handful of states, very few, that where CBD is not legal, period.
So I read somewhere that 64% of Americans are in support of legalization. And so is there at all a federal movement that you think will be successful to remove all of this ridiculous state to state?
Yeah, so
Because I mean, as we know now, like this is truly a medicine, and
yeah.
the inability of my patients who need this to get it is hard. It's very hard.
Yeah, so as we know, being physicians, big pharma has sort of a big say when it comes to laws and whatnot. So recently, a pharmaceutical company, GW Pharma, that's partnered up with Bayer, got a medication. So it's a botanical extract, and it comes from plants that are higher in CBD than THC. I don't know the exact amounts yet. But the FDA has approved this medication for specific uses, one of which is for epilepsy in pediatric patients with Dravet syndrome, right? And this happened very recently. So what's going to happen now is that DEA has 90 days to reschedule CBD. Because technically CBD is still a class 1 substance per federal regulation.
Yeah.
And there are nuances. It's very gray. Sometimes they'll say, it depends on what part of the plant that it comes from, especially when it comes to the hemp plant. So it's gray, but now we'll have to see what happens within the next 90 days in terms of rescheduling. So that may be a big change. And then we'll have to see how things move forward based on that.
Yeah. Well, it's unfortunate that it has to be,
I
a
know.
tablet and a pharmaceutical company when we have a plant that could, that you could do something out of. But I guess we'll take our wins where we can. So
and interestingly enough, so there's just one more thing I wanted to say based on synthetics and plant-based medicine. Okay. So there are synthetic versions of THC. They're like analogs of THC. And I don't know if you've heard of these medications, but Marinol is the trade name, and then Dronabinol as well. Now, interestingly enough, I've treated patients that have been on these medications, but yet they'll come to me for a prescription for a plant-based product, a whole plant-based product, saying that, I'm experiencing a lot of side effects from this, which makes sense, right? It's an isolated chemical, and there's not enough of a buffer for you to go, from therapeutic to toxic. Whereas with the plant-based, CBD, for instance, counteracts some of the side effects of THC.
Right. Yeah.
So
it's
so
like
that's
in
something.
Whole food, right? It's the whole plant. There's a reason why it grew like that.
Yeah, exactly. Yeah. So that was an important point that I wanted to make there.
Yeah, that's really interesting. Awesome. So I alluded to this a couple of times, but you sound like you have a big change for you. You've been brick and mortar in Walnut Creek, California.
Yeah.
You no longer have that clinic, and now you are doing virtual consults, and you're about to come out with a new product. And I want you to just kind of give us an overview of what that looks like, and what kind of patients you can treat, and what the limitations are for that, and what this product is.
Yeah. So basically, in terms of consults, I'm consulting now with people all over the world, which as a physician is an incredible feeling. I'm not doing it in the capacity of as the person's physician, but it's more as a consultant who's providing information. Mm-hmm. I mean, it's the same information that I'd provide my patients. It's just legalities.
Yeah.
But it's with folks all over the world. And basically I'm walking them through my protocol, right? So based on their, medical, we have a discussion about their medical condition. And then based on that, I walk them through, okay, first of all, what's going to be more appropriate? Marijuana-based products or hemp-based products? Then we go over, okay, how do you select these products? Mm-hmm. Then we go over which method is the best method of use, right? Yep. So for instance, like for anxiety, topicals are not going to work well. And that's sort of an obvious one, but there are other conditions where there's nuances to it, where certain methods of administration work better than others. So we'll go over that. And then we go over how much to use, which is very, very important. And then we go over how often to use the products and also when to use the products as well. And then the other concern that people have is, what about using these products, the CBD oils and the medical marijuana products with prescription medications? So that's something else that we go over. and also how to avoid and manage side effects, and then specifically how and where to buy these products as well, and
Yeah,
something else that I
that
go
was my
over.
question. Is that
Yeah,
I'm sure you have to do a lot of research in that person's community to give them,
yeah,
the right resources of where to go. And I think that would
yeah.
be really important for people who, are not used to like walking into a head shop,
No,
like
no, no.
like
Yeah,
the grandma with the rheumatoid arthritis, right? You want them to
yeah.
feel safe and comfortable and not like they're doing
Right.
something wrong. Yeah.
Yeah.
And then you're making what?
Yeah, so I'm also in the process of writing a book that's due to release in March of 2019. And then I'm also releasing a product, a hemp-based CBD product that's going to be available within the next 4 to 6 weeks. And I'm going to provide more information about this in my Facebook group. And the Facebook group is facebook.com/groups/ask the CBD expert.
Awesome.
So if any of your viewers are interested, they can send in a request to join that group, and they can get further information there.
Yeah, that's awesome. So I would really love it if you would put in there's first of all, there's a bunch of people who've been writing comments that I'm sure that they would love for you to respond to once we get done. So if you could do that,
Yeah.
and then put in the comments also, a link to that Facebook group, anything else that you think is important to know,
Sure.
your webpage or anything like that. And also how we can follow you on social media, whether you're on other social media besides Facebook, so that our viewers can
Sure.
follow along.
Yeah.
And this is really exciting. And thank you so much for joining me. I'm going to give a quick plug for Holist here real quick before you go. As all of my viewers know, Holist is a integrative care coordination company. We're bringing together teams of practitioners and providers and physicians to take care of unique health needs. We have a new relaunch of a weight wellness program that is launching in about a week and a half with a brand new delivery method. And I have 5 new weight wellness coaches and 3 mindset coaches, life coach, a hypnotherapist, and a meditation guide to add onto your team in terms of really tackling this tricky business of getting to that weight that makes you feel confident and comfortable and the rock star that you are. And so we're really excited about that. And follow along with us. And I'm at www.holisthealth.com and at holisthealth on most of the social media handles. And can you tell us your website real quick and your handles?
Sure.
And we'll say goodbye.
Sure. So my website is drrachnapatel.com. So it's DRRACHNAPATEL. And then the other place that I'd recommend going to is my YouTube channel. And you can just do a Google search for the medical marijuana expert YouTube, and it'll be one of the first results that pops up in Google. And I'm answering questions, your commonly asked questions on there.
Awesome.
On a regular basis.
I love that. That's great. So check out the comments, and thanks for joining me on this lovely Monday morning for our Medical Monday. And we'll be in touch.
Yep. Sounds good.
Take care.
Bye.